Thank you, everyone. Welcome to the first of our fiscal year 26 doula certification classes. I'm pleased to welcome Trent Holden. He is our central chaplain today, and he's provided this class before for all of our doulas as well as volunteers that are looking to support spiritual care, which we find is kind of lockstep with the end of life journey. So, and I also like to welcome Patty Dom, who is here as well. She is our manager of spiritual support services, as well as the social work team. And this is one of the blessings, one of the differences that makes Hospice of Cincinnati unique is the breadth and depth of services that we offer in the psychosocial realm. And so excited to have you learn more about that today. Again, just make sure you use the chat for any questions, comments, and this session is being recorded. So please be mindful of that. And I'm going to go ahead and share the presentation. Thank you for coming to presenting to us today, Trent.
Thank you, Lori.
Here we go. Okay, there we are. All right, go ahead. It's all yours.
All right. Well, good afternoon, everybody. As Lori said, my name is Trent Holden. I'm one of the chaplains for the Central team. And excuse me if I take my glasses on and off. They're actually reading glasses, and my eyes play tricks on me sometimes. So I might have to go on and off with the glasses every now and then. But let's see, I've been with Hospice of Cincinnati for a full 6 years almost. I'll be starting my 7th year in the middle of October. I'm ordained as a Presbyterian pastor, but as we'll find out later on through our presentation, chaplains aren't mainly representing their own faith. We try to represent the faith of all of our patients and families. So a broad range of spiritual matters there. Laura, you can go on to the next slide. I think it's just my introduction slide. That's me at a wedding, officiating a wedding. Neither of those are the groom, but those are two of my former students when I worked as a youth pastor. The bulk of my career so far has been spent in youth ministry, about 20 years or so. And you can go to the next slide. Here are the objectives for what we hope to accomplish in this little short presentation. The cultural and religious views of practices, identifying spiritual distress, what your role as the volunteer end-of-life doula can be, some helpful interventions that you might use, an understanding of life review or life story, and life story rather, support for unresponsive patients, this thing called compassion fatigue and how we can care for ourselves, and then other resources you might utilize as the volunteer. You can go to the next one. There are many, many perspectives on death and dying. First thing that I think we all need to look at are what we call cultural perspectives. They may be traditions that may or not be associated with a faith or spirituality, but could just be part of a family practice. So for instance, it's pretty common, I think, nowadays for people to plan their funerals before they die and to not leave things up to the grieving family members to do it all. I love that idea, but in my family, there is a tradition that the children of the deceased parents all go together to the funeral home to make final arrangements together as a family. This is a part of the grief process for my family. Personally, I would love it if my parents would plan their own funeral, but I know it's not something that's going to happen in great detail, and it will be my responsibility. So this isn't associated with any faith tradition or spiritual practice. It's just a part of my family's culture. And in hospice care, there may be traditions similar to that that are important to the family. For instance, calling in loved ones at the time of death in order for them to say goodbye. That's something I see very often. But culturally sensitive means we need to be looking at things like this perhaps maybe should be done in private. Or sometimes maybe somebody wants you to sit with them as they do this just to give them courage. And sometimes people want only people from their own faith or cultural community present when they're dying as well. And we need to be attentive to those needs. So when dealing with cultural issues around death and dying, remember there are always questions we can ask. And that's the best thing to do is just ask. A good example of a question would be, would you like me to step out of the room while you do this? Or would you like me to be present while you do this? Um, and then my favorite question is, how can I be helpful to you right now? And that's kind of open-ended and allows a person to respond however they may. And then there are other similar questions. Then there's religious specific traditions, practices surrounding death and dying. These are all across the board, many different faith traditions that we support at Hospice of Cincinnati. There could be theological and other spiritual beliefs surrounding what happens during or after a time of person's death that may be associated with ritual. We're going to click on this link now and take a look at a few of these. This resource is something that wasn't created by us. It was created by Healthcare Chaplaincy Network. Lori, if you want to scroll down, I believe the first one is Judaism. Yep, just a little bit further. There's an introduction. And then scroll down to the table just a little bit further, right there. So specifically, this document kind of is a quick reference guide. It's not exhaustive. There are other more nuanced details with all these faith traditions that would really need to be explored in depth to discover it all. But this is just a quick reference guide to kind of familiarize yourself with other faith traditions and what they may believe, especially around death and dying, which is one of the things I really appreciate here. So if you look at the box where it says death and dying, this is under the Judaism uh, faith category. Um, so let's see if I can go. So in Judaism, I think one of the big things down close to the bottom where it says, nope, sorry, cremation either prohibited or discouraged. So those are good things to know how things are. That's one of the quick references that I look at. The burial is recommended as soon as possible. Um, and let's see. Oh, and then prayers of the sick can be important to faith and illness for those who celebrate Judaism. So there's just some helpful notes here for us to keep in mind when somebody may come up. They may not be 100% familiar with their tradition. I've had this before where somebody is of a faith tradition and they're not sure if cremation's allowed and it's something that they're wondering about. So that's kind of what this reference can help. You can scroll down to the next one, the next faith tradition. Oh, there's many different things in Christianity. Keep scrolling there. Uh, this one's good. Eastern Orthodox. There's a couple of special things. They have their own prayers for the dead and certain times that they say them. So that's good for somebody of that tradition. Um, and then, yep, go down a little bit further. Yeah, Jehovah's Witness is a good one to look at. A lot of times, Jehovah's Witnesses are really connected with their faith community and don't want other spiritual care. It just depends. So don't always be offended about that. It's just part of their beliefs that they really want their people around them when they're dying at this very vulnerable state. But they view death as a state of total unconsciousness. Um, they this is a little outdated, and then it uses the word euthanasia. We don't really use that anymore. Um, but it's forbidden in their community, which may lead to some other views about medicine and treatment that they may refuse, or that sort of thing. So just to be aware of that might be why they refuse some things.
A
And then,
resistance to medication,
yep,
right? Resistant to
yeah,
accepting medication. So
and
that's something to be
sometimes,
very aware of.
yeah, and it's helpful for us to not to be aware of that so that we know not to push families who are in that, but maybe we can engage them in conversation about why they might not want to use medication, but just to be sensitive to that part of their faith. Go down one or two more. Uh, go past this one. It's pretty. Um, I think the next one's probably Protestant, but there's Seventh Day Adventist. There's a lot of Christian traditions represented. If you scroll down, I think there's Buddhist and Muslim. There's Islam right there. So they have, their own set of beliefs, and just this is a quick reference for us to be in tune to what some of those might be and how we might be able to engage them.
Yeah,
Um,
like the Muslims, they believe in that 5-step um, body of the washing, the dressing, the
yep.
positioning of the body, of same
And
gender.
for the for just in practice, I've always noticed if somebody is of Muslim faith and connected to their community, that they end up with a lot of visitors and a lot of people caring for the family. So sometimes they don't want a lot of outside support from their community because they already have so much of it from their community that's already really involved. So those are just things to be aware of, and not to be offended by, because it goes along with their tradition and we want to respect their traditions.
Mhm. Yep.
You can go back to the PowerPoint.
Okay.
And Lori, I think you've already provided that reference for them.
We have, yes,
Yeah,
we have, and we can continue to do that as well.
it's
So,
it's a very good, quick reference guide, in my opinion. I've consulted it many times.
mhm. Yep, it's right
Um,
on our volunteer VicNet. It's on the homepage of our app. It'll be listed as spiritual care reference.
okay. Um, let's see, you can go to the next slide. So as I mentioned before, it's always okay to ask questions, especially when you're not sure what to do. For some reason, as a young person, I always felt like I shouldn't ask so many questions, or if I didn't know the answer, I should just try and figure it out on my own. But when it comes to end of life, I think it's helpful to ask questions. What would be meaningful for you at this time? That's a good open question that someone can respond to. I've asked that at almost all of my visits, and I've gotten a different response every time. And then the other question I always ask is, what would be most helpful for me to do for you at this time? So a little bit different. They might say something completely out of my reach, as far as if I said, what would be meaningful for you at this time? And they might say something like, plan my next vacation, which is something I can't, really help somebody with. But then what is most helpful for me to do for you at this time? A lot of times people will say, can you pray for me? Um, I had a really interesting answer the other day, which I'm surprised I don't get this answer more often. But this was an ALS patient who didn't have the use of her hands anymore. And I said, what would be most helpful for me to do for you at this time? And she said, can you help me make 3 phone calls? And I
Oh,
thought, oh, yes, absolutely. I can help you do that. That's a very simple part of my job. So we went back to her room, and I dialed the numbers for her and put it on speakerphone so she could make those 3 phone calls and speak to those people that she really wanted to speak to. So asking those questions, was that spiritual care? It was in a manner, but not in the obvious way. And there are so many different variations of culture and faith traditions. It's just always helpful to ask and just find out what would be most helpful or meaningful. Sometimes they might belong to a faith tradition, but don't need you to help them connect with it at all. There might be other things like dialing a phone that would really help them. You can go to the next slide. Spiritual distress is something that we as chaplains really seek to deal with. So this is just an idea of what spiritual distress might look like, so that you can make a referral to a chaplain or even a social worker if a chaplain's not available to help delve into spiritual distress deeper. So when somebody, a patient or family member, a grieving family member, they may be asking questions about the meaning of life. That could be an indicator of spiritual distress. If they question their own belief system or they're losing spiritual or religious beliefs, that's a sign of spiritual distress. Asking questions about pain and suffering. Sometimes this come across as worry. Do you think I'll suffer at the end? You might hear things like that. Thinking bad thoughts or negative self-talk, even in their head. If you ask somebody, what are you thinking about? And it's all negative, that they reply with. Asking the question, why are bad things happening to me? Or why did I get this illness? Those are signs of spiritual distress. Anyone who has anger or despair, any of those strong negative emotions, signs of spiritual distress. If they're sad and depressed, if they're anxious, if they feel isolated or alone or abandoned by God. These are all things. Sorry about the noises. My dog is pacing and having a problem.
Not hearing it.
Okay. So these are all common indications of spiritual distress. This list isn't exhaustive. There may be other indicators as well. Someone expressing physical pain or anxiety that isn't resolved with medication, for instance. Um, and these are all instances where referral to a chaplain is beneficial and recommended.
Excellent.
You can go to the next one. We have this term called terminal agitation, and when to call a chaplain. Often when pain medication isn't working because there's unaddressed emotional or spiritual component. And we can talk about this more, maybe if you have questions about it. Those can lead into the chaplain role. And then yeah, there you go.
And I'm going to go ahead and just double check real quick that we don't have any. It looks like we've got some questions in the chat.
Okay.
Haviva asked if it is possible to get a copy of this. Yes, we will send out a copy of the recording, the transcription, and the slides after the session today. So again, if anybody else has any more questions, I don't see any hands raised, and I don't see anything in the Q&A or in the chat other than that. So we'll keep going here. Let's
Okay.
go ahead back to the PowerPoint. Great. So talk to us about the role of the chaplain, I think.
Yeah. So the role of the chaplain is really to help people find or work towards peace at end of life. So chaplains, we're unique. We're not just religious people. We're not always religious people. We're unique because we're required to be board certified and eligible for board certification and working towards it, if we're not, by a professional chaplain organization. A lot of hospice organizations will just utilize local clergy to meet spiritual needs of patients. But HOC requires chaplains to meet the high standard of National Board certification. This is all part of quality spiritual care in our opinion. So chaplains have at least a 72-hour graduate degree in theology or related field. We have 4 units of clinical pastoral education, which is postgraduate education that instructs us on how to be chaplains, not just religious leaders. We have to be endorsed by our own faith community, so endorsed and in good standing. Completion of written essays and an interview to demonstrate 32 professional competencies. And we have to have at least 2,000 hours of work experience as a healthcare chaplain. So that's who we are. All of your HOC chaplains, I believe, meet those requirements.
How many chaplains do we have?
Um, Altogether, I think there are 25, including our manager, Patty Dom.
Wow.
That includes our PRN optional chaplains as well as part-time and full-time.
And so we have a census of about 870. So that means your caseload is approximately, I can't do the math that much, but about how many do you have on caseload?
I can tell you my caseload hangs right around 60, 65 right now,
Okay.
which is, I think I'm one of the higher ones, has a higher caseload
And
right
so
now.
you try to see people about once a month
About
or?
once a month. There are some people, if we identify somebody who has a high spiritual need or maybe in distress, there are some people that I see at weekly, some people that I try and see twice a month. Oh, and Patty's commenting
Oh, okay. Patty's
about
commenting.
hiring
Okay,
more
let me stop
chaplains.
sharing real quick. Let me get Patty. Patty says we need to hire more. Our highest caseloads are in the 80s, which is well beyond the national recommendation. So we definitely need to hire
Yeah.
more as our census grows. And that's something that we're seeing across HOC is that our census is growing much faster than we're able to keep up with hiring for the need. So
Yeah.
very excited. I know Haviva is one of our chaplain CPE students with Hospice of Cincinnati. And we have several others who are currently in the program trying to receive their units of a continuing education. So excellent. I'm going to go back to the PowerPoint here. Here we go. Okay, go ahead.
Um, and the other thing to note just with chaplains is that we really try to bring a therapeutic level of intervention to our patients. So chaplains, when a new patient is admitted to the hospice program, the chaplain will either visit in person or contact by phone. We really try to visit in person to complete the spiritual assessment. And this is part of the 5-day holistic assessment in accordance with Medicare regulations. So that comprehensive spiritual assessment must be completed within that 5 days of a patient's admission into hospice program for HOC to receive reimbursement from Medicare. And that spiritual care also impacts our CAPS family satisfaction survey scores for emotional and spiritual support. I don't think the next slide talks about, let's see.
We go.
Oh yeah, there it does. The chaplain role, common questions. What does a chaplain emotional support vary? How, sorry, does a chaplain emotional support vary from a social worker at HOC? So there's a lot of overlap with what social workers and chaplains do, but there are some nuanced things. So chaplains, we are experts in faith and culture. So we identify spiritual and religious practices important to our patients and their families. We assess spiritual distress and other spiritual needs associated with a patient's illness. Sometimes that could be receiving sacraments that they need a specialized person to do for them. We also seek to resolve spiritual distress and increase peace at end of life. And then we always want to try and connect patients and families to their faith community and their resources. a priest or a rabbi to visit patients and families at their request, um, and then connections to religious organizations and faith traditions.
Or
Uh,
spiritual care volunteers that could visit more
yes.
frequently than that once a month, right?
And let me just add how important you all will be as spiritual care volunteers. I have so many patients of mine who enjoy their spiritual care volunteers who are able to visit maybe more often than I can, even though there's not a lot of spiritual distress happening. They still enjoy those visits, especially sacramental visits. There are several patients of mine who receive the Eucharist from some of our spiritual care volunteers who are Catholic Eucharistic ministers, and they absolutely love that. Um, which is something I can't bring to them. Obviously, I'm not Catholic. So let's see, where are we at? The
Social
social
worker.
worker. So social workers are a little bit more nuanced. They um, they really do help to identify patients and their families, help them to identify resources, and help them make end of life decisions. Um, They identify family and caregiver support systems already in place and where needs may arise as the patient's illness progresses. They may make recommendations on, hey, we really need you to provide more, care in the home. Um, they may talk about facility placement, if it's somebody coming from the home, um, and then finding resources to help support the caregivers. They do connect people to funeral homes so that families can begin planning as well if that's needed. But one of the other big things that social workers really do is that emotional support to help patients and families deal with loss and grief. So this is where a lot of overlap happens. A social worker can help identify some emotional and mental pain as well, that they can help talk through with some of our patients and families.
So, question for you is, do you provide funeral services? Do chaplains provide funeral services?
Um, most of our chaplains will respond to that request um, if a family says, "Hey, we really would like you to do the funeral." A lot of times we have many chaplains who will do that. It's If it happens, if it's a request during working hours, we almost always do it. If it's after hours, it's kind of up to the chaplain's availability if they're able to do it. And then another thing that happens if for some reason one of our chaplains is like, I really can't do the funeral, we'll put a request out to our whole chaplain network here at HOC and say, can anybody do this funeral? And there's almost always somebody who responds with, yes, I can help with that.
Excellent.
Yeah, so we do support families with funeral services if we're able to. Okay, the volunteer role. I mentioned before that I have many patients who enjoy the Eucharist being brought to them. Um, and then almost always I've seen some of our Eucharistic ministers also provide some of those familiar Catholic prayers to some of those patients as well, which is a very interesting thing. We know, especially with our dementia and Alzheimer's patients, that those traditional prayers that they're so used to saying are some of the last things to go. So I've had patients who cannot carry a conversation anymore, but the second you start with Our Father who art in heaven, they join right in praying those prayers. And it's kind of a beautiful thing to see that that they hold on to those traditional prayers. Volunteers also provide the Ministry of Presence, which is something that's, I think, very beneficial. The Ministry of Presence is simply being there with a person. They may not say anything, they may not be able to talk. You may be playing music, um, you may be watching a movie with them, but the Ministry of Presence is just being there. You can always share in storytelling. Tell me about your childhood. Tell me about your life. What are some of the things that you really love to do? What's your favorite vacation destination? Um, You may be the person that a patient or family member decides to confide in. So somebody that they feel they can trust and can share something with you that's very deep and meaningful for them. And then we can always provide prayer support, but it's important to do this according to the patient's identified faith tradition. So not to force our own prayers onto patients, but to ask them what their faith is and how we can pray for them in doing so. Some very common faith prayers. The 23rd Psalm is often a great one. A lot of Protestants will say this at the time of death or at funerals. And the use of the Bible translation that you have, I would recommend either the use of the New International Version, it's very current, it's very common, or the King James Version, which is very traditional. And sometimes people have a preference. So for me, if somebody asked me to say the 23rd Psalm, I usually pull it up on my phone and I just ask right away, do you want me to use the King James Version? Or do you want me to use a current version? Just because some people have a preference. And I always just ask. Then there's the Our Father, sometimes known as the Lord's Prayer as well. This is very, very well known, said by Protestants and Catholics, but they are a little bit different in the wording they use. So it's good just to familiarize yourself with how each tradition says the Our Father prayer just a little bit differently. The differences are only really towards the end. Mindfulness are things that we can do. The anchoring heart technique is something that the Veterans Administration or the Veterans, the VA hospital really promotes that in dealing with anxiety. There are other breathing exercises we can do. We can always read from their tradition scriptures or holy books. And again, I just ask what's their favorite passage or favorite stories from the Bible or books, holy books. Because you don't want to just open up a book like the Bible and start reading because you might find a spot that's not so comforting. Um, and then one of the other things is the breathing box technique, um, which this is a really simple breathing exercise, but it really helps to not only it can help to calm someone down in an anxious moment, but sometimes it's really good um, just as a way of centering somebody and helping them just kind of clear their head. The breathing box is really simple. If you just imagine the box where you're going to do four sides of the box and count to four. So you inhale for 4 seconds, you hold your breath for 4 seconds, you exhale for 4 seconds, and then you hold the exhale without inhaling again for 4 more seconds and do that a couple of times. Um, so I think it's helpful just to remember a lot of those things. There may be other things that you've also find helpful. For instance, we talk about playing music for somebody and identifying their music. There have been a couple of times where I've gone in to sit vigil for somebody, or even during a continuous care moment where somebody's agitated, and identified that music would be helpful at this moment, but they're so agitated they don't want to listen to music. So just a helpful suggestion that I've tried that has been helpful for me to come in and say, "Oh, I have this song I want you to listen to," and that kind of gives them like a show and tell moment that they're more open to. Um, so let them listen to the song that I have for them, and then after that song, ask, "What kind of music should I play for you that you enjoy?" And then that kind of has got my foot in the door so that they're more inclined to say yes to that request to play music, which is a huge help during those times of agitation. So just a little suggestion from my end. The other chaplain interventions, there are special rituals that some of us can do. Ordained clergy to officiate baptisms, communion, Eucharist, and then other rituals as well, something like dedication or something like that. We can help people process their feelings. This is something that one of our CPE education taught us. Um, and we're highly trained to be able to help somebody process their feelings effectively. And it's part of, I would say, all of our chaplains do this on a regular basis. We help them do life review, which is a larger look into a person's life, which includes issues of spiritual pain and grief. So it's a little bit different than the life story that we talk about later. But there may be some negative things that happen in their life that we help them process through and grieve, as well as moments of accomplishment and celebration. Family conversations. We can help facilitate difficult conversations between patients and their family members. I did one of these really recently between a father and a daughter. And it was um, a little bit of a breakthrough moment for them because I was able to bring into the conversation um, to ask some of those difficult questions that maybe they were afraid to ask each other. And one of them being, do you feel guilty about what's happening? And one of them was able to respond, yes, I feel very guilty, and I'm really worried about the decisions I'm making. And that helped them progress in their relationship um, to to really have those difficult conversations in a safe space. And then also, a lot of what I do is offering that ministry of presence, what you all will be doing as well, sitting with a person to provide a supportive presence, focusing on being present with a person. It may or may not include conversation or music. I've gone several times with people and just sat and watched TV with them. I, of course, always let them pick the station that we watch, right? Although I've noticed sometimes um, that I think this is perfectly appropriate to do. Sometimes you go into a facility and they're watching kind of a distressing, maybe like murder mystery or something, and for some of or a violent show, and it's like, I think there's something else we could watch and help them find something else that maybe isn't so distressing on TV. Um,
No.
which I recently had a patient who they were talking had a really disturbing moment where they thought they were in New York City and didn't know how they got there. And I was able to help the team identify like a lot of the things that they turn on the TV at this facility are like cop dramas that take place in New York City. So maybe we recommend watching something not so uh, or something more peaceful. You can go on to the
Well,
next one.
yeah, I've heard the same thing about the news. You have to be careful about the news coverage and a variety of things that may
I,
be happening there.
I
Yeah.
actually discovered that during the
Oh,
pandemic. I used to read the news to some people. Um, I would sit down and I would start reading the news, and all of the headlines were negative, and I thought, I need to find something else to do because this isn't providing peace.
there you go. I'm just checking the chat. We've got no more questions right now, and I don't see any hands raised, so we'll just keep going through the presentation. So I think it's up to me.
Okay.
I think maybe I'm here, so let me make sure I share my screen correctly. This a big if. Here we go. And you're going to go down to life review. Um, oh, okay. Fast forward through to life review. So Trent and Patty and I have spent quite a bit of time trying to convey the distinction between life review and life story. And really, life review is a therapeutic intervention that requires a significant amount of professional training by someone in a pastoral or counseling role. Um, and it's really about the process of evaluating one's memories. And oftentimes, where there has been trauma and distress that are included in that. Whereas what we call life story work is really an intervention that is focusing on reminiscing and revisiting of one's personal recollections, is sort of more reflective, to help them highlight and enjoy those things. And so typically a life story would not be something of distress in somebody's life. Maybe they would have wisdom or be reflective about it, but it shouldn't overall be distressing. And so we really want to make sure that the chaplain is in charge of anything that is seen as a life review, and that the volunteer remains focused on kind of the capturing of those reminiscing, revisiting discussions, and can be in support of each other. Now, that does not mean that if somebody starts to share something distressing with you, we want you to call a timeout and say, wait, I can't hear about that. That sounds like life review. By any means, right? Right, Trent? But
Right.
we want you to know that that is a situation where we really need to probably escalate post visit to the chaplain that's assigned, because you may be the person that they've chosen to share something with. And that's a good thing, but we want you to not feel like you've been prepared for how to deal with those heavy and complex emotions. And so maybe that's a time when the next visit you could go together with the chaplain, or you could give them a report that maybe the next time the chaplain or the social worker visits, to ask maybe more pointed questions in a particular direction that would help to address some of those needs as a therapeutic intervention. Um, good words to use would be just the general active listening skills that volunteers are taught, which is to validate their emotions, saying, that must have been so hard, or I can't imagine how hard that must have been. Or I can see that that was distressing for you. So validating their emotions, and then also just inviting them to say, oftentimes I think the best way to, when you get into a difficult conversation, or I wouldn't say difficult, but I'd say a hard conversation, a heavy conversation, is to say, I don't know what to say right now, but I'm here with you and I'm willing to listen if you want to share. Does that sound like good advice, Trent?
Yes. Always good advice just to validate feelings and things that may happen. Um, Sometimes, occasionally, there may be somebody who says something very shocking to you, but it's always helpful to try and temper our own emotions and those, um, to kind of be non-judgmental, and just say, I really am here to listen. Um, so
Yeah. And
I will.
I will share just from a personal story that I was visiting with a patient, and they shared with me. I noticed that every time a male would come into the room, they would kind of recoil and not really engage in a perspective stance, and ended up sharing with me that she had been sexually assaulted.
Mm,
And so that was information then that helped to, I did not dig into it a whole lot with her, but we were able to assign a female chaplain to visit with her, as well as a social worker to lead, and then to also look at the constitution of her care team to be more sensitive to that experience. So just an
yeah.
example of how volunteers can be really link arms to provide that culturally relevant care. So,
One other thing with this life review and life story thing, I've often used reminiscing and revisiting um, old memories, happy memories with patients as a way to help in distress. So I recently had a patient who um, loved the beach, and had a long history of life on the beach, even growing up as a little girl. Um, and her and her family were against a lot of medication at the end of her life because they wanted her to be alert. So she was in a lot of pain. So one of the things I would do would be to go in and remind her, picture yourself on the beach in your favorite spot, and then ask questions. Oh, what are you drinking? Or, one of the things that she told me as an adult was she had her favorite little cabana spot and would like to sit there with, I can't remember what the name of the drink was, but some kind of cocktail that was her favorite. And I would always ask her, close your eyes. Can you picture yourself drinking that cocktail right now? And she would say yes, and it was a little comforting for her.
Nice.
A lot of times we do have unresponsive patients, patients who um, can't really speak or interact in our visits. There's still a lot that we can do for them. So it's helpful for us as a team to learn all that we can prior to our visits. We can get this information from their families. We can get it from other team members. Um, we can get it from all kinds of people who may have heard a word here or there in passing.
Or do an
Uh,
about me board. Now we can do an
oh
about
yeah,
me board.
the
Yeah.
About Me board, that's very helpful now. Um, and then always introduce yourself as if the patient is alert and oriented. So sometimes when I walk in and there's family there, I'll say hi to the family first, and then I'll turn to the patient and introduce myself, even if they're not um, really interacting at all, as if they're alert and oriented, and then kind of look at the family for guidance to let me know how else I should proceed. I always tell them who I am, what my role is, and how I hope to serve them. So I use my AID-IT. Um, I tell them that I am there for help and comfort. Um, let's see. So just giving verbal cues to the patient, like let's try some prayer or something like that, and tell them what I'm going to do. And I watch for nonverbal signs or distress or even comfort. A brow that furrows or relaxes, breathing that slows and is peaceful or may become rapid, facial relaxing or grimacing, hands that are clutched or relaxed. I think it was last week I went and saw somebody at the inpatient unit, and as soon as I introduced myself as the chaplain, they made this horrible face. And I said, "Oh, is that distressing to you?" And she said, "I'm not dead yet." So I think it was a bit distressing to her to have me introduce myself as the chaplain, but was able to reassure her immediately that I'm just there for peace and comfort. Um, so if we're doing an activity with a patient, we don't want to make it a long activity, something that will wear them out. I tell them how long I'm going to sit with them. Um, if I'm going to be there 15 minutes or 20 minutes, or I might say I'm going to sit down for the next 30 minutes if that's okay and watch TV with you. Um, and then of course I always conclude the visit with a thank you, a lot of times a blessing, um, something like that. Um, yeah, and there's a lot that can happen in a visit like that. Then there's this thing called compassion fatigue. Compassion fatigue, it's this term that describes the physical, emotional, and psychological impact of helping others, often through experiences of stress or trauma. Compassion fatigue is often mistaken for burnout, which is the cumulative sense of fatigue or dissatisfaction. A lot of people in the helping communities who provide care will begin to feel this compassion fatigue. Um, I thought I had another note here. Then there's caregiver burnout. It's the state of physical, emotional, and mental exhaustion. It may be accompanied by a change in attitude from positive and caring to negative and unconcerned. Burnout can occur when caregivers don't get the help they need, or if they try to do more than they're able, physically or financially. We see this a lot. This is one of the reasons why our inpatient units, our hospice provides respite care for caregivers and caregiver burnout. And one of the things that we seek to encourage our home care patients to take advantage of. Um, so anyone can feel this, especially in a helping community. It could be something that the chaplain or social worker feels. It could be something that you as the volunteer doula may feel as well. So it's always important to do our own self-care and make sure that we're taking care of our own needs as well.
And I do want to share, Trent, that it's always okay to share with your volunteer coordinator um, 2 words. No. I need to take a step back. No, I can't take this on right now. Um, and help. No and help are 2 good words for us. We know that it can be very heavy caring for people and seeing people in distress or even not being cared for very well and feeling very helpless. As a volunteer, um, you have big hearts and you want to see people well, and sometimes that doesn't always happen, and it can feel very helpless if you can't do anything about it. And so really encourage you to take advantage of some of the resources we have together. We have a monthly doula networking that anybody is welcome to attend, where we support each other in that type of a group as well. The Goldstein Grief Center, if you lose a patient or family, or even within your own patient or family, those are available to you. Um, and for individual as well as for group grief support. And then we have our lending library. So lots of really good books. They're all donated volumes. So if you have something that you would like to donate, please do, to help support each other. Um, for a long time, we did donuts and divinity, and I think we were looking at reinstituting this with the chaplains in each of the regions with kind of the spiritual care, but also just the volunteers that are in their regions that would like to attend. I know, for instance, at Blue Ash, they have a really good book club that meets that I think is very refreshing. We have our Tikkun farm retreats that are available for volunteers. If you are interested, reach out to me and I will see if it's space available, but I will see if we can encourage that, as well as any additional resources. But know that you are in a good group of people, that the team members that go to these and are part of these situations are very familiar with the frustration that you may be feeling. And so having a community of people that share that frustration, understand the challenges, is kind of the best way through this type of challenge, because you're never alone. So, yeah.
I'll add too that all of our chaplains are very willing and eager to support. If you have questions about resources or connecting people with things, just know who the chaplain is and reach out to them. They should respond very eagerly that they are happy to help in any way that they can to make you successful as a volunteer.
Yeah, exactly. So, revolving just the hospice care model, remember the patient and family is at the center. And the volunteers are part of that team, as is the chaplain, the social worker, the grief counselor. It's one of the strongest things I think about hospice care is that interdisciplinary team model of care. So, and then that's it. So I'm going to go back to our stop sharing and just see if we have any other comments, questions. If you would like, I'm going to go ahead at this point. So since we have a few moments left, if anybody would like to, I'm going to raise your hand up at the top, or send a chat, and I'll be happy to unmute you if you have any feedback or discussions? Anyone? Okay. Well, on that note, we'll just go ahead and thank you all for attending today, and stop the video and end the session. And thank you, Trent. Oh, Jen Schmitz is typing something right now, so let me see what we have here. What is AIDIT? That's a great question. Joan, I know it's been a long time since you've been in orientation, so go ahead. You want to talk? You want to do it, Trent, or you want me to take it?
So AIDIT is the way that we introduce ourselves as part of the Tri-Health culture, Tri-Health and Hospice of Cincinnati. So let me see if I can remember what they all stand for. Acknowledge and introduce. Duration means I'm going to tell them how long I'm going to be doing what I'm doing. Explain what I'm going to be doing. Is that right?
Yes, you got it. One
And
more.
what's the last one? Oh, thank them. Thank them at
You
the end of
got
the visit.
it.
I did get
Nice
it.
job.
It
Nice
becomes,
job.
we develop our own way to introduce ourselves, including all of those things. So we sometimes forget what they all stand for, but those are
Yeah,
all the components that we like to use when introducing ourselves.
they are. And I will say that given the high prevalence of dementia amongst our populations, you really would not probably want, it would probably be overwhelming for people with cognitive decline to include all of that.
Yeah.
But the idea is to at least greet people and give them the feeling of a warm and engaging presence with your name.
And
Yeah.
I'll add too, don't be afraid to introduce yourself at every visit because
Yeah.
even if you visited somebody and think they may remember you or not,
Mhm.
sometimes it can add to their frustration if it just say, I do it every time. I'm going to introduce myself every time to you. And that kind of calms things down a little too.
There we go. So what's the hardest thing about being a chaplain, Trent?
Oh gosh. Um, So it can be very difficult sometimes to sit in those very distressful, continuous care moments when somebody's in distress, and knowing that as the chaplain, I can only do this much. And it's not, I can't add any medical interventions. I can't help you get medication for pain. I can just sit with you in the pain, and that can be kind of difficult sometimes, but takes a lot of practice.
It takes practice, yes, yes. Um and learning over time, right?
Yeah.
It's nothing that anybody gets right off the bat.
And even though it can be distressful for us, it does help the patient because I've had
It
patients who
does.
are like, I don't want to be alone. I don't want to be alone. Please stay with me. Even though I can't help them, I'm helping them by staying there with them in their pain. So it does help. It does. It is a good intervention.
Right. So what is the best thing that a volunteer can do to support a patient's spiritual care?
Um, I would say just ask questions, do what the
Next
patient
question.
wants you to do or what the family wants you to do. Um, Sometimes we think it's helpful if we go in with an agenda of something that, oh, you're from this faith. Oh, you want to do this certain activity or this sort of thing. And just pay attention to who they are as a person, um, and let their own needs and wants override anything that may happen that day. Um, so,
Yeah, I know. The first thing I always say whenever I'm asked, what do hospice volunteers do? It's real easy. We show up.
hmm,
We show up with the gift of our time and our attention.
yeah.
And
And
that's
what's
it.
really
If we
great,
do that, everything else will be okay.
if you have access to a smartphone, you have access to so many resources that you can do in the moment. There are games that you could play with a patient. You could read a book. You could listen to an audio book together. There's just so many things at our fingertips that we can utilize that don't have to have a huge plan involved.
Just just being together.
Yeah.
human connection. Well, thank you, Trent. Thank you, everyone, and appreciate your engagement today. And we will share this after the session. Have a wonderful day. Take care.
Bye,
Bye-bye.
everyone.